Okay, good afternoon, good morning, or good evening, wherever you're joining us from. A huge thanks for joining us for this webinar, Technology in Dental Education. And we're here and we've got a great alliance with Virteasy Dental. So whilst you're watching, if you're watching through virteasy.com, to the right of the screen, you'll see a Mentimeter application. There's a code just above it, and if you enter the code, you'll be able to join in throughout the webinar up on your screen now. So the first question on the Mentimeter is just which country are you joining us from today? And I see we've got a huge amount of people from India with us today, so huge welcome and thank you for joining us. And behind that, various UK, United Kingdom captions with Mentimeter. Please do join in today, and it'd be our honour. So we get back to the presentation now, and before we do some introductions to who's with us today, for those of you who are on a level playing field with everyone else, just want to go over how universities train at the moment and the benefits of haptics and virtual reality, the way that we see them. So universities at the moment, they train on real patients attached to their clinics, extracted teeth, which come from patient treatments, and if we're lucky, then we'll be able to do that more often. But in the vast majority of cases, students practice on plastic teeth inside phantom heads, often just at a single density, so we don't actually feel the difference between the enamel, the dentine, and going through to the pulp. So a standard education might look like only theory, for instance, in the first year, before going onto phantom heads and then practicing on real patients. Now, you know as well as we do, that gives you a number of challenges. First of all is practicing on real patients, potentially putting them at risk if it's too early on in a student's training, which could mean claims against university, renewing all the plastic teeth every time we use them, for instance. And lastly, students expect technology, they expect a modern curriculum in this day and age, so they come to university and you don't want them to be disappointed in finding out the virus at the moment, the spread of diseases, especially when the clinics traditionally use aerosols, social distancing, how can we keep people far enough away from each other, and how can we support at-risk students from coming back to the teaching environment as well. So that gives you a little basic understanding of why we're doing this, and you'll see the benefits of haptics and VR in this. So like I say, we've got a great lineup with our state induction. So let me just bring up, and Arno, are you with us? To you for a little introduction of HRV.
Okay. Hello, everybody. Thank you, James, for this webinar. 7 years ago, in 2000, today, it has been development and I think major deployment because we have a setup for classroom that is ready to use. We can change the way we teach dentistry, bringing a very, very structured Virteasy approach with 3 different software that James will introduce. First is Editor, that is basically the tool that will allow the simulation software, and Virteasy Assistant that will allow to follow the assessment of. I'm very happy to deliver a great move into that technology. It's the time for haptic technology, dental surgery training. That's all for me. I'm very confident about the fact that James will bring you all the details of all those tools and software, and we would be very happy to work with you in the future. Thank you very much, and thank you, James, for the webinar.
Of research, so many years of development, have everything that goes with it. It's not just a question of having a simulator there. So like I say, we've also got with us today, that don't know me already, my name is James Markey and I run the sales for Virteasy Dental, and I'm also the product owner, which makes me the customer contact for all of our universities. So I've been here the last few years and we've seen Virteasy grow into an international business, which is now in 15 or more universities more than 30 universities in more than 15 countries. So it's certainly starting to take off, and I think with all the implications of coronavirus, we're going to see simulation becoming a lot more mainstream as well. So if I've not met you already, I look forward to chatting to you after this webinar and catching up by phone or by email before we can come out and visit you in person. So then we've also got some representatives from Tashkent State Dental Institute, and I'm just going to see if we've got Bekhzod. Are you there? Yes. Fab. Well, you're up on the screen. Your microphone's working. So I'll hand over to you for a little introduction.
Good afternoon, dear participants. I am Bekhzod Yarmukhamedov, Vice Rector of Tashkent State Dental Institute from Uzbekistan, and
Okay, well, a huge thank you to everyone for holding on. We're just trying to get the screen share working on the Skype. But what I'll do, I'll hand you over back to the Mentimeter, so you'll be able to join in and just let us know whether or not you've already got haptic and VR simulation in your university, and we'll be back in a few moments. Thank you. It looks like the majority of you, this is actually your first experience in haptics and VR, which is fantastic for us because usually we have people, when they join us, have already had experience with it. So what this gives us a great opportunity to do is actually, we'll hand you over very shortly to Tashkent, who's got a very nice presentation about everything that's been going on and the history of virtual simulation, and then looking at accreditation, and then I'll hand you over to Tashkent, who's going to go through their
Virtual surgical planning is a service that provides surgeons with a clear 3D visualization of a patient's anatomy to develop a surgical plan prior to entering the operating room. All of the various professionals would tell you that there's nothing like working with the strength and control of your bare hands. And our haptic device creates a realistic user interface that delivers just that. The sensation of using a virtual tool that feels real while offering greater control than a traditional mouse ever could. And the ability to touch, manipulate, and create the most realistic details imaginable.
So hopefully that's a great opportunity for those of you that are new to haptics and VR to get a photo behind me, a wide range of happening of the history of sim. So in the 50s we started cutouts, plane that allows us to help training as it'd be hard to find following the same that you get from a patient. And they had those teeth and the jaw, implantology, and then we've got not just looking at these, looking at so those as well. You're seeing our offices which are based getting ready for one of the releases. That gives you a little introduction.
All subjects from restoration, prosthodontics, endodontics, and implantology.
A number of top. So these high fidelity going on. The high means that your hand are these powerful hats you've seen. It's got the most DICOM in. It's based on Linux, so a custom build of a Linux operating system. So everything just starts up and works. And we work with other companies. We open up all our formats and we try to work with Dentsply Sirona there, for instance, as well as our competitors. Just to give you an idea of the classroom environment. It starts with a creator program, so you can create your exercises based on patient data, either from our 3D library, your intra-oral scans, or a CT DICOM as well. Then once we're on the simulator, that allows us to carry out the exercise briefing for the results. Your classes, your group, and to give you a final understanding desktop or virtual machine and the editor. And then you have the CT scans, the intraoral scans feeding in to create new exercises, and everything can do on the phantom head, learning theory as well as using this. And then lastly, a line you're really seeing it and appreciate it. So I really want you to. So I'm going to turn. So you can restoration, pause, and then go exercises. You'll see the logo, in fact. So like I say, we have our. If I pick up now to the tooth later around, we can zoom in and we can see exactly. Here, I can look and the red is. So like I say, I can actually feel. That just gives you a 3D view that can be set for the student. So the students can file so that you'll be able to were thinking and with no for their presentation some of.
I can make every kind with the real patient. I think that dentine and pulp, I can really
about such project. So as for because I'm very happy to work such
Institute relationship with the internationally. We're going to see if we can get his presentation.
Yes. Yes. Good afternoon. 160 universal doctors. Training. Our institute is in the CIS progress in Kazakhstan. We have conducted required model development of our institute from first in our medical education association on a virtual laboratory complex. This complex digitally replaces our 20 laboratory equipment and performs our 14 laboratory work. At the third year, students master practice skill precedence our students. Traditionally, 40 years ago, of the world's population smartphones simulate lack of understanding now. In right to medical ability of the last stage of traditional teaching skill by teacher, assistant in operation, required components of traditional education. To be or not to be? Small study. The aim of in dental implantology, 30 men at the confidence were given rated the main points of survey was the result just which was up at this rated is pleasant passive of new skills was 2 times and learning teaching combines the answers were shall be using the modern equipment advantage imitation of real manipulation. Now we have a lot process educational technologies efforts with foreign partners in the educational process. Important and replication of the necessary to exchange of things confidence in such which you need to ask 10 months and 10 years. By answering the is between traditional and skills. We will report. Let me introduce standards for pedagogical innovation. Being a good doctor is not only encyclopedic knowledge and perfect master of the technique of medical manipulation, but also the ability to communicate with both the patient and colleagues of domestic health care in general. But at the same time, they are an effective and efficient tool for solving certain problems. To achieve worldwide recognition, while we President and God help us. Thank you for your attention.
And like I say, it was an absolute pleasure for us to come to Tashkent, come to Uzbekistan when we did the training, the installation, national with the simulators. National competitions have you
last
our universities and the international because it looks you can help us with. So I've got one for you here actually. What's the situation like?
Us is only distance.
Okay, fantastically. When you're talking about which and something that module in the simulator, so we might be able to look minutes later and then for 10 months, almost the same as the last few years, rating the haptic to give you a little. So mega professional, but there are graphics. But for all our universities take advantage, but technology have integrated line today, and all so where it's just coronavirus other than a distance from. But what's relation? So obviously not in the way and get back team, and especially to keep out more on our web. So there's not a massive thanks through so much Bekhzod and